Thank you for joining us this morning for the Purpose Power 2021 Summit. Tired of accepting the status quo in an industry slow to adapt, New York's largest healthcare provider, Northwell Health, decided to raise expectations for themselves and for the communities they serve of what health can and should be. To kick off the Purpose Power Summit, we have Northwell's CEO, Michael Dowling, and his Chief Marketing Officer, Ramon Soto, to talk about how activating its purpose helped to galvanize audiences, foster change, and forever raise the bar industry-wide. Gentlemen, welcome. Let me start with you, Michael. Brand purpose, right? Such an important tool for success, and yet very often overlooked. How did you know that you needed to uncover a purpose, and how did you go about figuring out what it was?
We are the largest health system in New York State, and we are the largest employer. So we have the biggest provider of care, and we have all parts of the healthcare delivery system. But because of our scale and our size, we're also a major influencer and have the potential to be a major catalyst. And what is our role? Our role is to improve health overall, not just individual health, but in health overall for the community. And so we wanted to make sure that we represent that viewpoint to the public, that we're going to be different. We're going to be more creative, more entrepreneurial. We're going to take a broader view of health than the view that most people take. Most people think about health systems as dealing with illness only. But what we're all about is promoting health, the broader definition of health. That is our overall purpose. That's where I think we can have a unique role and become an innovator for other health systems across the region and the country.
So that doesn't necessarily make sense from a profit standpoint, right? You know, I have a spouse in healthcare. She records appointments, and if she doesn't have enough appointments in a week, that's problematic. That's where the money is made. How do you justify having this broader view of why Northwell exists when not all of it will filter directly into your P&L?
Well, there is enough illness around, unfortunately, and we will always have enough illness treatment to be able to make sure that the business side of the organization is successful. But we're going to be transitioning more and more because the reimbursement is going to be changing over time, so that we are going to increasingly become paid and get paid for actually health promotion, wellness, and prevention, and not just only for treatment of illness. So I'm not worried about the business implications of this. I, in fact, think that if we send a message that we're about overall health in general and influencing others to improve their health, that from a business point of view, we can, in fact, be doing the right thing, be doing the moral thing, and have a good business outcome at the same time. These are not inconsistent with one another at all. And if we have a health system and you're not in the business of promoting health and you're only in the business solely of just treating illness purely from the business point of view, then I think you lose your moral compass. And that's not where Northwell is. That's where Northwell wants to be.
I think this is an exciting idea and one that in other forms have proven to have a terrific ROI, so I applaud that. Ramon, purpose exists within an organization, but is also articulated outside of it. I want to talk about the inside first, right? When most of us think about a healthcare business, we think about who we interface with, right? And for most of the public, that's the doctors. And in fact, your organization includes executives like you, doctors as well, maintenance people, even volunteers. How do you articulate the purpose message to them in a way that they absorb it and then can sort of move forward with that idea in mind?
Yeah, Scott, it's a great question, and thank you for inviting us here. This is really the intersection of culture and health, and it takes a very unique individual to really run towards the flames when consumers need us. And I think we saw a lot of the spirit and the ethos of our employees throughout the COVID pandemic. That was an exceptional view of who these individuals are. But the reality is they practice this every day. They're in the business of making sure that an individual gets to their best state of health. So it's actually quite easy to engage with them. Michael's built an extraordinary organization, 75,000 employees, over 5,000 physicians who are employed by the health system, probably about 17,000 nurses, Michael. And the reality is by echoing their purpose, by taking what they do every day and lifting it up, by really reinforcing the mission and the unique individual it takes to execute that mission. We've seen our employee engagement scores rocket over the last 5 years. I think we were in the 50th percentile about 5 years ago. We're now in the 92nd percentile in terms of employee engagement scores. There's really a pride of being here. That story in and of itself tells itself. And we've also seen, from a metric standpoint, Northwell increase as a best place to work from a Fortune 100 standpoint. I believe we're in
number 19.
Number 19. So, Scott, I think you see this pride echo itself in this organization in a very, very powerful way. And that actually helps us establish the platform to tell the story on the outside.
And let me just add something here also, Scott. All my people and employees at every level, from the security guard to the environmental worker to the laundry worker to the doc, I am a strong believer that they just don't want to work for an organization, they want to belong to a cause. I think, especially in the healthcare world, they want to have a mission, they want to have a focus, they want to know that you're doing something good overall for the community. That, I think, is part of the bonding aspect of the culture. And you've got to send that message broadly. And when, for example, we talk an awful lot sometimes, and many times, especially this time of year on Memorial Day, we talk an awful lot about veterans. Well, that gets extraordinary support. When we talk about gun violence as a health issue, as a public health issue, it gets extraordinary support. And I get inundated with memos and emails and texts from employees when we discuss these issues. So they understand that what they have got to do every day is X, but being part of something that does X plus, that we raise health overall. And by raising health overall and having that as a brand, we raise their expectations. We raise their sense of community, their sense of belonging. We raise their commitment to the culture. And the community around us sees the same thing. So I think it's a different way to look at the organization. We just don't look at what we do only from the narrow perspective of ROI itself. And obviously we're not stupid. We are interested in making sure our business is sustainable. But I think our business will be more sustainable the more that we focus on raising health for everybody in the community and having that be our brand.
I think that's a great insight in terms of employee engagement as well, right? I think one of the things we've seen that the pandemic has done is sort of suggested to a lot of people that they should question work. Does work matter? What am I doing? Does it matter? And so organizations with a well-defined purpose, I think, will retain employees and keep them more motivated than ones that don't as we start to return to normal and as we see, I think, a lot of employee change across the landscape. You might have insulated yourself from that. A question for either of you, Ramon. You mentioned it first. Was that you have folks who run toward the fire essentially in healthcare, first responders, essential workers, people in emergency rooms, and those emergency rooms have been more than full in the last year or so. How did specifically your articulation of purpose help get you through the pandemic?
Yeah. So, Scott, it's a great question. I will suggest to you personally, it was the best of times and the worst of times. I've never been more proud to work in an industry that really put itself out there to, in our case, protect New Yorkers. New York was the early epicenter of COVID in the United States, and Northwell, being the largest healthcare provider, was the epicenter of COVID in New York. And we saw individuals very selflessly put themselves out there to protect us. And I will tell you, they were very scary days. That sense of purpose, that you cannot articulate that in a written form. You can't make that up. There is a spirit underneath that. It's the fundamental root call of their calling. It's something exceptional that allowed us to shape that purpose and really share back with them our pride in what they were doing, the support that we were going to offer them, that we were going to lead selflessly to make sure that they were empowered, that we removed bureaucracy, that they had the tools that they need to practice their skill. And we did that in a very reinforcing way to celebrate their service and the things that they were doing. So purpose was both embedded in their actions, and then we just simply reinforced that in terms of our internal communications to let them know, to over communicate what we were doing, where we were going, and how they were just an essential part of recovering from COVID. I said it was the best of times, the worst of times. Super proud about what we did. At the same time, the human tragedy was palpable and tremendous. That's actually created a long-term weight that we have to deal with. So the emotional well-being, the behavioral well-being of our workforce is really a key consideration right now, who they are. And we'll do the same thing that we did during COVID. We'll be there to support them. We will unleash resources to make sure that they're their best selves, and that they continue this pride, this esprit de corps, this execution of the mission that's so important to society today.
I think that's one thing we haven't really reckoned with is the aftermath of the pandemic. Not only the physical or health effects that might linger for people, but also the emotional ones. So you think that having an articulated purpose actually helps folks, and I can imagine that it not only motivates them to go back to work, but even participate in their own wellness, understanding that they're an important piece of society, and so have to continue on.
Well, let me just add on this that the COVID experience was a learning experience, because if you ever were thinking or wanted to think about the importance of health overall, and importance about health in its broadest sense, then you experience it during COVID, because obviously we saw certain communities being disproportionately affected by COVID. The employees saw it in each other because they were working each and every day in very, very dire circumstances, requiring an awful lot of courage and commitment and dedication, especially when their own families sometimes were in dire circumstances. So I believe that everybody that went through this has a different perspective about health now, a different perspective about what our responsibility and obligation is now, and a different perspective about how we all have to work together, which during COVID, every discipline, every part of the organization came together and worked together. And you talk about commitment and culture, right after COVID, where we were at the epicenter at the beginning, but when it relaxed a little bit in the beginning of the summer, and other parts of the country were in trouble, we put out a call to see if any of our employees, after going through what they went through here, whether they were interested in helping others in other parts of the country. We got thousands of positive responses of people who actually were willing to leave here, despite the fact of having dealt with what they had to deal with here, and go to other states. And we had hundreds of people go to other states. That shows an unbelievable commitment. It shows true character. It shows what healthcare workers are made of and what they're all about. And quite frankly, it's a lesson for the rest of us. It's a lesson for other organizations of what you can do in a crisis to better the lives of others. And I do think that we will be better off because of COVID. And we're not going back to the old normal. That is a new normal now. The world is going to be different. And I think innovative organizations, for every organization that wants to be innovative, is not trying to reimagine what is the direction for the next decade and what we need to be doing differently. And I think we want to be at the forefront of that innovation and that creativity. We want to be able to be distinctive with what it is we do, because our job is not, in my view, not just doing what's good for us inside our organization, is how we develop partnerships, how we influence others, how we get people to take responsibility for their own health, how we look at issues that we haven't looked at before in terms of their influence and health, like issues like environmental issues, climate change, gun control, et cetera, et cetera. So I think COVID has changed us all. And if we look at it the right way, it has changed us all for the better.
Let me suggest, in addition to what Michael just said, the culture is so important, and the culture that Michael has shaped here is exceptional, and it's really driven top down. Michael embodies this view that you're either at the forefront of change or you're the victim of it, and the need to push forward was really illuminated through COVID. We've seen the societal fractures, the economic, the social issues that are so apparent through COVID. And that desire to change, that desire to move forward, the desire to address issues that other health systems have not, is part of the DNA of who we are and the culture. It adds to purpose. It adds to the reason to believe. Michael brought up gun violence. About 2 years ago, we launched an initiative to treat gun violence as a national healthcare epidemic, to really talk about the healthcare lane of gun violence, not to treat it as a Second Amendment issue. But that is a very palpable example of dealing with the frontier issue that no other health system in the country had been dealing with. Drawing attention to the cause, layering on the purpose of why we do what we do, and driving that pride in the employee base. Our employees responded very strongly, very proudly. They're part of our voice in moving this to a very different level, and we've seen some good progress in that regard.
So you mentioned treating healthcare gun violence as a public health issue. You've talked about, I know, food deserts as well, and fitness activity. I often see commercials on television for healthcare organizations that focus on just how somebody got me well. You're less transactional than that. In being less transactional, it's harder to put an ROI on your communication. How do you make that decision? What's appropriate to communicate? What's not to the public? And how do you know if you've hit the mark? Another example, I think I saw on television the other night that you are sponsoring a concert here in New York.
Yes. So I'll start, and I'm sure Michael will join in. Look, the reality is consumers have great choices in New York. We have strong competitors. You can get great care at a number of different places. So how do you differentiate yourself? And in our case, we really try to occupy a different territory than our peers. Most of our peers speak in convention, and the convention is historically something like this. I got injured, I got ill, I went to this wonderful place, I saw this fabulous doctor, I got better, insert logo here. What we try to do is really speak to purpose in a way that reflects where culture and healthcare meet. And then we try to put the Northwell story right at the center of those two things. And it is a rich territory that allows us to speak about all the things that healthcare enables, your life, your love, your career, your passions, a journey, a partnership. And once we embrace that territory, these realms of storytelling open up so that at the brand level, we can engage with consumers in a very different way. Michael and I have teamed up to build a destination healthcare brand that, of course, we will fight for market share when the health event happens, but we want to have a relationship. Think longitudinally. Think about your healthcare journey over time. And the stories that we tell are meant to evoke this positive view of who we are, what we do, and how we can take the journey with the individual. And we found purpose to be a very, very fertile territory. We want better health for all, and we want to raise health of the community. And we recognize that as a partnership. We have an active role to take. We know consumers have their own active role to take to raise their own health. The flexibility of the platform really allows us to own that territory in a very unique way. And then we have to also fight for the transaction. So no margin, no mission. I have to fight for individuals who are going through a health event and have them choose our facility. So there's more tactical work, almost performance marketing work that we do to ensure if somebody is going through a health event, they're going to come to our space. Those two spaces very much complement each other, and they're integrated. They're born from each other, and we found it's a very powerful platform. We have grown market share in our market. We're the #1 healthcare provider for a reason. About 50% of our growth has been organic in nature, and consumer perception has never been higher. Consumer awareness has never been higher. Net promoter score has never been higher.
So all good traditional metrics that you can point to for having gone through purpose. Michael, we're almost out of time. I want to put the last question to you, and that is, there are a lot of other CEOs, business founders, both large and small, listening to us today. What is the one piece of advice you have for them around finding their own purpose?
Well, I think it gets to the essence of what leadership is. So you can manage your organization. You can manage for the present. You can manage what was, or you can lead for the future. So what is the legacy you want to leave behind? How do you want to make a difference? How do you want to change the agenda? How do you want to change the talking points? So leadership is about creating a new future. And if there is any time to do that, right, post-COVID, now is the time. So we have to pivot to taking on a more distinctive, different role. So if you're a CEO, you obviously have a responsibility inside your organization to change that and reimagine it, but you also have a major responsibility outside. As a CEO, you're listened to. You have influence. Now, how are you going to use it? And in my view, you use it, and this is what we are doing and will continue to do and escalate it, is to raise health for everybody. So, for example, getting people back to work improves health. Generating a strong economy improves health. Having people employed instead of being unemployed improves health. What you do with housing improves health. Now, we can't do all of this ourselves, but if you want to be the leader, you can influence others to take a responsibility to do something about it. Catalyst role, which is very, very important. So I would say to other CEOs, when you get up in the morning and ask yourself the question, what do I really want to do today that's different?
And I think from you, we've heard that today, and I think there's no better benchmark for me than being able to say that I'm grateful you're in the community because it clearly makes a difference. Ramon, Michael, thank you both for being here today.